Let's roll up to roll out.
You know, it's me, Mr. HE, and I'm here with one message: roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear our face mask, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
Just witnessed the handing over of a generous donation of 20,000 doses of the AstraZeneca Oxford vaccine.
It was a kind donation, as India understands that it is important for us to be able to ensure that the entire world is free of COVID-19, and the only way we can do that is through vaccination.
We welcome these additional doses because it would help us to provide a significant coverage, a greater percentage of our population in terms of vaccination against this virus.
And just to note that St. Kitts and Nevis is also paying forward, and we are going to assist the government and people of Grenada by donating 2,000 of those 20,000 to the people of Grenada. And so once again, we just want to thank the government of India, and remember, don't wait, vaccinate.
Tonight we had another successful town hall meeting in which we engaged the community regarding the vaccination rollout in St. Kitts and Nevis. As of this afternoon, we had just under 6,000 persons who have been vaccinated. That brings us close to 18% of our target population, which we need to have vaccinated to achieve herd immunity. Tonight's session was to bring the information to the people in a manner in which they have the opportunity to share their concerns, to express their fears, and to have them answered by the professional and the experts in the health ministry. I want to commend our Medical Chief of Staff, Dr. Cameron Wilkinson, our Permanent Secretary in Health, Dr. Dolores Stapleton Harris, and of course the District Medical Doctor, Dr. Bernicia Nisbet, for participating in this very rich experience for the people of the community of St. Paul's and the adjoining areas. I think this has been highly successful. We had a sense of joy. We, at the end of the question and answer period, a number of persons moved forward to have their vaccination. That tells me that it was very persuasive, it was impactful, and it has helped. And I know these persons are going to be ambassadors. They're going to be out there with their own experience, sharing with others, and as a consequence, we're going to have more persons participating in the program.
just witnessed the handing over of a generous donation of 20,000 doses of the AstraZeneca Oxford vaccine.
It was a kind donation, as India understands that it is important for us to be able to ensure that the entire world is free of COVID-19, and the only way we can do that is through vaccination.
We welcome these additional doses because it would help us to provide a significant coverage, a greater percentage of our population in terms of vaccination against this virus.
And just to note that St. Kitts and Nevis is also paying forward, and we are going to assist the government and people of Grenada by donating 2,000 of those 20,000 to the people of Grenada. And so once again, we just want to thank the government of India, and remember, don't wait, vaccinate.
You know, it's me, Mr. HE, and I'm here with one message: roll up to roll out. We all know how difficult things have been during this COVID-19 pandemic. While we continue to wash our hands, wear our face masks, and practice social distancing, how about we take it one step further and get vaccinated? Call the nearest health center to find out if you are eligible to be vaccinated. Or you can contact the Ministry of Health at any one of these numbers down below. Don't be discouraged by the negativity. We all have a role to play in protecting this federation. So, St. Kitts and Nevis, let's roll up to roll out.
I will take the vaccine because building defenses against COVID-19 is a team effort, and we are all a key part of that defense.
I definitely will be taking the vaccine when it's my turn.
I will be taking the vaccine as it is an important tool in the fight against the pandemic.
It is important for me to vaccinate to ensure that if I do become infected with the disease, it can prevent hospitalization. In addition, it also helps with herd immunity.
I will take the vaccine to protect myself, my loved ones, my clients, my co-workers, my community.
St. Kitts and Nevis, why do we need to vaccinate? Tanisha? So we can jab COVID-19 away.
It's only just a phase. Once we're vaccinated, and everybody gonna be safe. Everybody gonna be safe. One kind, one people. We are roll up to roll out. Cause no man's alone. Do what's right. Cause I love you, brother, my sister. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah, yeah. It's better for us, yeah. I don't wanna lose you. I love you too much, yeah, yeah. It's better for us. Tell your mommy to roll up to roll out.
Bless up, Dejo here, and I'm doing my part in the fight against COVID-19 by following all safety protocols and, most importantly, rolling up my sleeve for the vaccine. So I'm encouraging you to do the same, because that's our best shot of protecting ourselves, our family, and our friends. So don't wait, vaccinate. Let's roll up to roll out.
Tonight we are in the Boyd's community at the Brantywell Primary School, where we took the education to the community. We allowed the persons within the community to be able to ask questions about the AstraZeneca Oxford COVID-19 vaccine. We were privileged enough to have Dr. Wilkerson here with us tonight, sharing the information and answering the questions. We had quite a number of questions from the persons who were here, and fortunately for us, we were able to get quite a number of persons who were able to sign up as well and are willing now to take the vaccine because they were able to have this session. This is the first in a number of community level sessions that we are going to have with persons, because we know it's important for persons to be able to ask the questions and be able to debunk some of the myths and the untruths that are out there about the COVID-19 vaccines. And so we are happy that we were able to be here at the Brantywell Primary School in Boyds. Next Wednesday we're going to be in two communities actually. We're going to be in the St. Johnson Community Center, but we're also going to have another team that's going to be at the McKnight Community Center doing the same thing, sharing the information and giving persons as much feedback as we can about the AstraZeneca COVID-19, because it's important for us to make sure that we reach that 70% herd immunity necessary for us to be able to get our lives back to as normal as possible. And so we're encouraging everyone to roll up, to roll out. Don't wait, vaccinate.
St. Kitts and Nevis, let's roll up to roll out. It's our best shot.
Hey, what's up?
I'm good. Bless up.
Nice. How was the recording?
It was good, man. It was good. You know, always a pleasure trying to send a message to my people. All right,
Love it.
We would like to welcome our Minister of Health, the Honorable Akila Byron Nisbet, who's blessed us with her presence to speak a little bit on the COVID-19 related matters as we move forward to achieving 70% herd immunity. So we have a few questions for her, and we'll get into them right away. So, Ms. Nisbet, how's the roll up to roll out campaign going so far?
It's going really good. We have just over 5,000 persons who've already been vaccinated, and more persons lining up to vaccinate. And at this point, we're at that stage where we're actually going out into the communities and vaccinating persons where they are, which is also very helpful.
Right.
So it's going really good. And your song has been making an impact too.
Nice. I don't wanna lose you. No, man. All right, so next question. What's the process to get vaccinated and where do you go? What's the key?
It's actually really easy. All you have to do is show up at any of our 11 health centers. 11. There's a short checklist that you have to fill out just for us to make sure everything is okay with you and get some background on your health. And then a nurse, nice friendly nurse, will take you to one of our rooms, give you that injection. After you finish being vaccinated, sit for 15 minutes. Once you're all clear, good to go. Pretty easy. 1, 2, 3, done.
All right. So what would you say to those still skeptical about taking the vaccine?
I'm going to tell them it's simple. We've already have over 5,000 persons who've taken the vaccine and everybody's still good. Just a little pain in the arm around the injection site. Some persons had fever and chill, but that's all part of vaccination. The way you think about it, that means the vaccine is working. Right. And so I would say to those persons, don't hesitate. Don't wait. So many persons already got the vaccine. So why not you? Right. You're helping yourself, you're helping your family, you're helping your community. So roll up to roll out.
Don't wait, just vaccinate. Come on, man. We know at the vaccine stage, what can we expect for the next 6 to 9 months?
What we can expect is that once people get vaccinated and we reach that 70% herd immunity, then we can start talking about relaxing some of the quarantine restrictions and some of the other restrictions. It's about thinking about when you're traveling. So then you don't want to have to travel and come back and quarantine for 2 weeks. Because then you have to add all that into your vacation time. If we can get to herd immunity, which means you could get enough people vaccinated so that if the virus gets in, it does not spread as much as it's been spreading without the vaccine, then we could relax the quarantine and then you wouldn't have to spend that 14 days in quarantine anymore. We can relax that. You can travel a little bit more freely. If you look at it, some of the countries are even implementing vaccine passports, which means that you have to be vaccinated to travel to some of these countries. So we're going to see some changes, good and bad, because COVID is real and it's taken a lot of lives throughout the world. And so the only way that we'll be able to make sure everybody is safe is if we get vaccinated. So once we're able to reach that herd immunity, that's when we'll begin to see that we're able to relax some of the restrictions, more of the restrictions, that is. We can travel a little bit more freely. We can relax some of the quarantine time. So that's what we can expect. But we have to get to that 70% mark.
Good evening, everyone. Welcome to this vaccination educational session and clinic this evening here at the Ottleys Community Center. Before we get into the meat of things, kindly stand as I invite Pastor Islyn Lewis to the podium to prefer prayers.
Almighty God, the God who is our strong tower, who is our help and our everlasting portion. We lift our hearts to you in praise and thanksgiving for all that you have done on our behalf. We declare that there is no other God like you or to be compared to you. God, sometimes things seem impossible to us, but we have proven that if we put our trust in you, you will make all things possible. We thank you, God, for the vision and foresight of our leaders of this beautiful federation in this season, a season where there is so much fear, misunderstanding, and confusion amongst our people. But we are reminded that you have not given us the spirit of fear, but of love, of power, and of a sound mind. We thank you for the discerning spirit and for the guidance that our leaders have sought from you to put in place plans to protect our federation and its people during this season. We know it is not because of any good thing that we have done, but it is because of your favor on us. You have blessed us, oh God, and we are grateful. God, we thank you for the medical professionals, the vaccine companies, and all who had anything to do with the development of this vaccine as means of finding a cure for us, for this virus. We pray, oh God, that as the discussion is held tonight, that you will open the minds of our people so we could have a better understanding of the benefits of the vaccine. Lord, cover all of us with your blood and continue to protect us from all harm and danger. Guide this discussion, and may your will be done. In Jesus' precious name, amen.
We thank, of course, Pastor Lewis for that very inspiring and inspirational prayer. In everything we do, we must give God thanks. And it's very apt tonight to do so, because as we contain and combat the COVID virus, we need a lot of praise. No amount of praise could be enough. So thank you very much. Good evening once again, and I wish to welcome all of you again to this very important vaccination educational session and clinic. I am Dolores Stapleton Harris, the Permanent Secretary of Health, and I am pleased to be here chairing this evening's session. I wish to welcome in particular, Dr. the Honorable Timothy Harris, our illustrious Prime Minister, Dr. the Honorable Bernice Nisbet, Senator and District Medical Officer, my esteemed colleague at the head table, Dr. Cameron Wilkinson, the main facilitator of this evening's session, members of the healthcare and health promotion team. I have seen some doctors, Dr. Osborne, Dr. Crawford, Dr. Offray and Mrs. Offray, and I bid all of you welcome. And of course, members of the media corps. You would recall that the coronavirus struck our shores in March of last year, 2020. Tonight's engagement is part of the Ministry of Health comprehensive communication strategy to support the COVID-19 response and vaccination program. This response and program have been led by our health experts and education facilitators, and it is built on the successful communication and engagement program delivered throughout the COVID-19 pandemic to date. Our main objectives of this communication strategy are to provide prompt, simple, and focused information on the COVID-19 vaccine and the vaccination process, building public confidence on the safety and efficacy of our vaccine to reduce vaccine hesitancy, ensuring understanding and addressing the concerns of persons waiting to be vaccinated, and maintaining the message on key preventative behaviors such as the wearing of masks, the maintaining of physical and social distances, and hand washing. And of course, reducing the influence of any myth or misinformation regarding the vaccine. So the aim of the Ministry of Health and the government is to reach everyone, individuals, families, organizations, and communities in St. Kitts and Nevis, to sensitize, to educate, and to empower, and to gain momentum with increasing trust and confidence as persons are assured of the safety and effectiveness of the vaccine. And until residents and citizens realize that being vaccinated is something that we all have to do. So the focus of the presentation tonight is the continued rollout of the COVID-19 vaccine, the Oxford AstraZeneca vaccine, in response to the pandemic, subsequent to our successful national launch on Monday the 22nd of February 2021, which aligns with the theme mentioned by our Prime Minister, St. Kitts and Nevis, on the path to recovery. And so, there are three main goals as we move on the path to recovery: to prevent outbreaks and transmission of the virus, to protect the entire population of St. Kitts and Nevis, and to minimize the impact of the pandemic on our health systems and our socio-economic activities. I wish to publicly commend all our residents and citizens who have been complying with the non-pharmaceutical measures, which I mentioned prior: the hand washing, the wearing of masks, the proper coughing techniques to combat the virus. You must be thanked for your compliance. I must also express gratitude to the staff of the Ministry of Health, particularly the members of the HUOC, our nurses and doctors, and our frontline workers for their expertise and for their commitment and dedication in managing the virus thus far. But our health team did indicate that our people and our beloved Federation would not be safe until we receive a vaccine. While our Federation has done well in combating the virus, we have to do better by being vaccinated. Don't wait. Well, as you are aware, the vaccine is now here, so the focus of tonight's discussion is a continued rollout. The Ministry of Health is indeed very optimistic that this recovery goal can be achieved once we get your support, everyone's support. Therefore, it is with much pleasure that I call our renowned Medical Chief of Staff, Dr. Cameron Wilkinson, to speak about the vaccines and to answer your questions, any questions that you may have about the process. Thank you.
Thank you very much, P.S. Harris. Let me say how delighted I am to be here this evening to share some information with you about the vaccine. All of you know that we are in the middle of a pandemic. However, because the pandemic has been handled so well by the Federation of St. Kitts and Nevis, and we have not had any major hospitalizations or deaths, there has been some complacency that is stepping in. Now, this pandemic requires an all-of-government support, and at the head of that is the Prime Minister, the Honorable Timothy Harris. And I want to congratulate him for the work that he's been doing to get us to this stage. It also requires the all-of-society approach, and at the core of that are the persons in the community. They are individuals like you sitting here, and it's important for us to come forward and get the message to you and to answer any questions you may have. Now, some persons seem to think that vaccines just came up the other day, and so there are a lot of skeptics about the vaccine. But I want to start off with a little bit of history, because in 1760, and it might sound like a very long time ago, more than 400,000 Europeans were dying from smallpox. Now, a rumor started where they noticed that the field workers who were working with the cows, they were not dying and they were not getting sick. And there's a surgeon's apprentice whose name was Jenner, went to investigate, and he noticed that the persons who were working with the cows, they were infected previously with cowpox, which was a virus that was similar to smallpox but not as deadly. And because of that, they had resistance, they were immune. And so they were not getting sick from smallpox and not dying from smallpox. And what he did, he started to infect people with the cowpox. And that is how they were able to stem the tide of death and get out of the pandemic from the smallpox. Now, most of you who are over the age of 55 or 56 would not have received a smallpox vaccine. The older ones would have, but because persons stepped forward and took the smallpox vaccine, we were able to eradicate it, not just from the Federation, but from the entire world, so that we can continue to live our lives. We were reminded again of how devastating a virus can be in 1918, when they had the Spanish flu, and more than 500 million persons were infected by the Spanish flu. And by the time it came to an end in April 1920, more than 100 million persons were dead. Now, we are lucky to have been born in this time, because despite the fact that we are fighting a virus that kills persons, we have a vaccine now that can help us. And so whereas the persons who were fighting the Spanish flu didn't have a chance at all, we have a vaccine or vaccines that we know are effective, that can save lives, and that can prevent major hospitalization. And so it's important for us to understand the importance of this. Now, we said all along, since the start of this pandemic, that it was only a vaccine that was going to save us. We did very well with the non-pharmaceutical measures, wearing the mask, etc., hand sanitizing, but it's time for us to move to the other step and get vaccinated. All of you might know that our vaccination program started on the 22nd of February. And at that time, the first two persons who went forward, myself, the Prime Minister, and after that, all of the cabinet members. We also had the top brass from the police force, the army. More than 90% of the doctors in the Federation of St. Kitts stepped forward and took the vaccine. Almost all of our nurses took the vaccine. Members of the opposition, they took the vaccine. Now, if we have all of these persons who supposedly are well educated and have most of the facts about the vaccine, and they have taken it, it must mean that this vaccine is good, because there is no way 90% of the doctors in the Federation, which means that almost every single doctor you would have gone to for advice would have taken this vaccine, and yet it would not be good. And so you have good reason to take it. So I'm happy to say, though, that persons have been stepping forward, because as of today, we have 7,322 persons, yes, who have taken the vaccine. And that has brought us to 22.2% of the target population. And what I'm hoping for, that by the end of this week or early next week, we would have reached a quarter of the population, which is a major milestone, because when you look at our figures per capita, in other words, you might hear in Barbados they vaccinated 20,000 people, but when you prorate it for their population, we are doing much better than a number of countries around the entire world. And so we need to congratulate the people of the Federation of St. Kitts and Nevis for that. Now, it's important for you to know what's involved in bringing a vaccine to the market and into your arm. These vaccines have to go through extensive trials. They start off first by doing trials in animals to determine the dose and if it will work. And then they apply to the world regulatory bodies to see whether or not they can have them tested in human beings. And they have to go through a number of layers, clinical stage 1, 2, 3, before they can be given authorization to go into your hand. Now, there are a lot of trials that are out there, over 200 trials that are still stuck at the animal stage, because the requirements are so stringent that only 60 have gotten into the clinical stage, and only about 8 have been given authorization to be given to persons. So once a vaccine has been deemed safe to be used in human beings, you know that it would have gone through rigorous testing, and thousands of persons would have volunteered to do the testing before it comes to you. And so we can say that these vaccines are safe. Now, one of the things that we have said here in the Federation of St. Kitts and Nevis, that we would not use any vaccines unless they were authorized by a reputable body. And so we're not using anything unless it's authorized by the World Health Organization. And so the AstraZeneca vaccine that we have chosen to use is what is being used mainly by the World Health Organization. And so just by that stamp of approval, we know that it is safe. Now, some persons might ask me, what can you tell me about this vaccine? This vaccine is basically a vaccine to boost your immune system. And so when persons are concerned about taking the vaccine, if you are taking tablets for diabetes, hypertension, even a paracetamol, that might have more deleterious effect on your system if you were to read the side effects from some of these drugs compared to a simple vaccine that is just a little part of the germ that is being put into you so that you can mount a natural immune response. And so if you're someone who takes vitamins to boost your immune system, you can take the vaccine to boost your immune system, because that is all it is doing. It is preparing you for when you come into contact with the deadly virus, you can develop these proteins to kill the deadly virus and you can stay healthy. Now, we know that this has been tested in people over the age of 18, and so anybody in the Federation who is over the age of 18, they should step forward and take it. We also know that it has been tested in people over the age of 65. Now, here in the Federation, however, we say that between the age of 18 and 80, you can go forward and take it. But some persons who are elderly, over the age of 80, they might be elderly and very frail. In other words, getting down in age, have multiple medical problems. And so although the vaccine is thought to be safe in these persons, we put an extra level of security by saying that you should check your doctor first to make sure that you're fit enough to take it. Okay? Now, the vaccine gives you an efficacy of about 82.4%, which means that once you get vaccinated, you have more than an 80% chance of not getting sick, not dying from the virus. And anybody who went to school, if you got 80-something%, that was a lot. You understand? And so we know that this vaccine is effective. Now, in addition to that, if we have most of the persons in the Federation taking the vaccine, the effectiveness of the vaccine itself reaches almost 100%. In other words, if the persons at our ports of entry, the people working at the airport, etc., take the vaccine, even if somebody comes in and they're sick, they would not bring it and spread it into the community, because they would have that protective core, preventing the virus from coming in. And so if you're working at one of our ports of entry, if you're a police officer, if you're a doctor, if you're a nurse, if you're working in the tourism industry, if you're in contact with anybody at all, you should step forward and take the vaccine. Now, when some persons heard that the vaccine that we got, or that was called Oxford AstraZeneca, that it was made by the Serum Institute in India, they tried to use that as a negative. However, the Serum Institute in India is the world's largest manufacturer of vaccines. They produce more than 1.6 billion doses each year. And that is why Oxford chose to give them the contract to make the vaccine. Not only that, almost every single vaccine you would have received coming through our school was from the Serum Institute of India. More than 2/3 of the world's population would have gotten their vaccines from the Serum Institute of India. And when you go home, look at your pressure medication, your sugar medication, etc., and you would see it was probably made in India by the Serum Institute. And so it's actually a plus when you hear that this vaccine was made by the Serum Institute of India, because more than 170 countries around the face of the globe, they source their vaccines from the Serum Institute of India. Now, I want to give you some reasons why you should take the vaccine. And at the end of this presentation, if you have no doubts in your mind, you can go straight to the nurse and sign up so that you can get your vaccination. If you still have some questions, you can ask publicly here. Some persons are afraid to go to the mic. And we have a number of doctors. We have Dr. Crawford, Dr. Osborne, Dr. Nisbet, Dr. Offrey in the audience. You can go and speak to them privately so that they can allay any doubts you may have. Now, the first reason why you should take it is that it is free. It's 100% free. And when I say it is free, maybe when the Prime Minister comes up, he might disagree with me. It is free to you, but he had to figure out how we were going to pay for it, and he might tell you how that was done. But all you need to know is that you just need to show up at your health center, roll up your sleeve, and you will take it. Now, The other day when I was in a town hall meeting, a gentleman asked me a very important question. He said, for those persons who don't take it now, will they have to pay a price for it? And I said yes, and he was shocked with my answer, because the price I'm talking about is not a monetary price. But once we open up the country and people start to come in, the virus is going to come also, and the persons who did not take the vaccine, those are the ones who are going to suffer. They might have COVID-19 disease, severe debilitating disease. Unfortunately, they might even die. And so that is the price you might have to pay for inaction. And persons have said that inaction can be even more dangerous than the virus itself. Now, the other reason why you need to take the vaccine, because we know it is highly effective. In other words, you take the vaccine, it can prevent you from getting sick. More than 67% of persons who take the vaccine don't get sick at all, and the others, if they get sick, the disease is so mild, they don't even know. You might wake up just thinking, well, you have a little headache because you drank too much last night, and not realize that you had a mild case of COVID-19. But more importantly, it prevents you from getting serious disease, from being hospitalized, and from dying. And so because of that, that's a good reason why you should take it. We also know that it saves lives. In that, in the Caribbean, all the here in St. Kitts, we haven't had any deaths. More than 10,000 persons have died so far from COVID-19. In the big United States of America, with all of their might, more than 500,000, 538,000 persons are dead so far from the virus. And around the globe, more than 2.6 million persons. So again, we have to be thankful that we were born on this little rock, and that we are here safe and sound, but we need to take the next step, because the virus is going to keep coming. Last week, you heard about case number 42 and number 43, and just yesterday, we had case number 44. Now, it's only a matter of time before this virus gets into the community, and we start to have community spread. And so the only how you're going to protect yourself is with the vaccine. We also know that the vaccine is safe, okay? Now, there are some persons with fake news that say it will change your DNA and all those different things. That is not so at all. All it's going to do is boost your immune system. Not only that, we had some good news today, because I know some of you all would have heard that there was some talk about whether or not it was linked to the formation of clots. And in the United Kingdom, in Europe, they had 37 cases of persons getting clots out of 17 million persons who had received the vaccine. And from the World Health Organization, more than 268 million persons had received the vaccine without any effect at all. And it's important for you to know that although, even if you take the vaccine, that doesn't stop you from getting sick from other diseases. And so sometimes people wrongly attribute some of the effects they have to the vaccine just because they would have gotten their vaccine. And so I was happy when the World Health Organization and the European Medical Agency came out today stating categorically that the AstraZeneca vaccine is safe, it is effective, and it is not linked to the formation of any clots at all. Okay? And so we are happy again that we have a vaccine that is safe and that is effective. Now, there are some persons who might say that they might not take the vaccine because they have allergies. And having allergies is not a reason for you not to take the vaccine. Because a lot of times when persons say they have allergies, they're talking like to dust, or to certain medications, etc. But unless you have an allergy to one of the ingredients in the vaccine, you will not have a problem. And most of the ingredients, histidine, magnesium chloride, these are things that are found almost in every single stuff that we eat. The only thing that very, 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 very few people have a reaction to something that's called polysorbate 80 in the vaccine. And so unless you know that you have an allergy to that, even if you have other allergies, you can take the vaccine. Now, another important reason why you must take the vaccine is that you're not just doing it for yourself, but you're doing it for others. In other words, you're doing it to protect the vulnerable, because it's not everyone who can take the vaccine. We said it is only indicated for people over the age of 18. Okay? And we also said that if you're over the age of 80 and you're frail, you should not take it, or you should consult with your doctor first. And this is where herd immunity comes in. Now, most of you all would have looked at National Geographic, and we can learn a lot from anybody, and we learn something from the animals. In that, when you have a herd of elephants traveling, and the lion comes after them to look for a meal, what they do, they form a circle, and they put the little ones and the elderly in the center, and the big strong ones stand on the outside to protect the frail and the vulnerable, so that the lion cannot eat them. And that is what we mean when we speak about herd immunity. We are hoping to immunize over 70% of the population of those persons who can take the vaccine, so that you can protect those who can't. And so if you're someone who have children, if you have a grandchild, if you have grandparents, if you have any elderly persons in your community, when you roll up your sleeve and decide to take the vaccine, you're taking it to protect them. So it's a noble thing that you're doing, not just for yourself, but for the other persons as well. Now, you are not only doing this just to protect yourself and the persons here, but you're doing it to protect future generations. And when I say that, we have successfully eliminated a number of diseases from the face of the earth by people before us rolling up their sleeve and taking the vaccine. Now, if you don't do the right thing, and the rest of the world don't do the right thing, and roll up your sleeve and take the vaccine, it means that future generations are going to have to contend with this COVID-19 virus. But we can decide that we are going to protect ourselves, we're going to protect the vulnerable, and we're going to protect the unborn, so that they won't have to deal with this deadly virus in 2021, 2022, 2023. Okay? And so for anyone who is not advocating the use of this effective vaccine that we know scientifically works, they're not interested in you right now. They're not interested in the elderly and the young. They're not interested in the future generations, because scientifically we know that it works. And if millions of persons around the world have been taking it, why the 47,000 people we have here shouldn't? Okay? Now, there's some persons who said, oh, they want to wait. But there's no reason for you to wait at all, because this virus is like a fire that is trying to consume your house. And if you don't act now to put out the fire with the vaccine, it's going to consume your home, it's going to consume you and your family. And so there is no reason for us to wait at all. I was speaking to somebody that they say, oh, they're waiting for the Cuban vaccine. The Cuban vaccine haven't even come through all of the clinical trials as yet. If we had a fire here right now in this auditorium and somebody had a fire extinguisher, are we going to use it, or are we going to say we're going to wait for the fire truck to come from town? We will use the fire extinguisher, okay? And so we have a vaccine now that we know is effective and that can save lives, and so there is no reason for us to wait. Not only that, when you wait and the virus continue to circulate, more variants will develop. In other words, the vaccine will change, the virus will change, because it is always trying to infect you and kill you, you know. And so it might become more infectious and more deadly. And the vaccines we have available now may not be able to fight it. And so the sooner we can eliminate it, the better it is. Now, another reason why you need to take the vaccine is because by taking it, you protect your health system. And when I say that, I remember last year, it was a bittersweet moment, because we had this big ceremony at the OTI where the Prime Minister announced that he was injecting over $15 million into the health system to help us shore up our response for COVID-19. And that very same night, we had our first case. And so we didn't even get a chance to celebrate. But the point I'm making, though, is if we can eliminate this virus from our country and make sure that everybody is immunized, we can focus on the diseases that are killing persons, the non-communicable diseases, diabetes, hypertension, etc. Not that we have taken our eyes off of them, but at least we can have a laser eye focus once we put COVID-19 behind, because we know that it can be eradicated with the vaccine. Another reason why you should take it, because it keeps you financially strong. Now, it's not everybody who gets COVID-19 is going to die, but there's something that's called long-haul COVID, where you can get sick and you continue to have headaches, weakness, develop blood clots from the disease, etc. And next thing you know, you're out of work, you can't support your family. And so if you take the vaccine, it will ensure that you will stay healthy and strong, and you will continue to support your family. And there's some persons who say, oh, you know, I will take vitamins and exercise so I don't get COVID-19. You can be as strong as an ox, but once this virus attacks you, it can kill you. And so there have been athletes, bodybuilders, fitness fanatics who have died from this virus. Now, another reason why you should take the vaccine is that it helps to prevent the spread of fake news, in that when you roll up your sleeve and take the vaccine, you are telling the person that I believe in science. I don't believe in the garbage that you're trying to tell me that I shouldn't take this vaccine. And you'll be surprised how many other persons would follow you. I was busy talking to a friend of mine from up in the village for about a week and a half, trying to get him to take the vaccine. And then he called me and I said, Doc, I got my shot, you know. I said, yes, you finally got convinced? He said, no, I saw the mansion bull take it. And if the mansion bull take it, I can take it. And so the point I'm making is anybody can have a platform, you know. So he wasn't listening to me. But when he saw the mansion bull, who he knew from since he was a child, take the vaccine, he went forward and take the vaccine. And so all of you here, there is somebody who is looking at you. And if you do the right thing tonight, other persons will follow you and we'll get to herd immunity. Because the last reason why you need to take the vaccine is so that we can get back to some sense of normalcy. You know, I'm looking around the room. I'm sure that behind those masks, we have a lot of handsome young men and beautiful women. But you have to be walking around with this mask covering your face. This is not normal. We can't continue like this. I mean, as a surgeon, I'm accustomed to wear a mask during the day, but I was happy at the end of an operation to pull that mask off. You know how distressing it is for me leaving the theater and having to go and put back on a mask? This is not normal. We are also social human beings. This thing about social distancing, we cannot continue doing this forever. Otherwise, it will start to affect us mentally. There are a number of persons who are suffering already. Last year, on Mother's Day, they were saying the greatest gift you can give to your mother and your grandmother is to stay away. That's not how we want to live. So this year, Mother's Day, I hope he hasn't gone to that, right? Mother's Day, no. This year's Mother's Day, we need to be able to get back close to our loved ones and hug them and kiss them. But the only how we can get there is through the vaccine. There are some persons who love to go to church. Right now, the church is half empty. You want to be able to go back with your brethren and jump and shout and praise the Lord together. Okay? And so by taking the vaccine, that's how we're going to get the churches full again. There are some persons who love to go to concerts, etc. Sorry. There are some persons who love to go to concerts, etc. And if you love to go to a concert, the only how we're going to get back music festival and all these different things is if persons choose to vaccinate. The other day, I was looking at a funeral in the cemetery. And I said, well, who passed away? They said somebody from the village. And I couldn't believe it because I don't know what happens over here in the country, but if you're from Newtown or the village and somebody dies, the entire community shows up. That's one of the biggest funerals you can have in Bastia if somebody from Newtown or the village died. And they had 8 or 10 persons by the cemetery for somebody who had contributed a significant amount of time to the people in the village, because we had to have this social distancing. We can't continue like this. And so to get back our weddings, our church services, our funerals, our concerts, music festival, sporting events, carnival, the only how we can do that is if you roll up your sleeve and you vaccinate. So I want to end by saying, don't hesitate, vaccinate. And I'm sorry for those persons outside who were not hearing me. I wish you had told me that before. Thank you.
There you had it from Dr. Wilkinson. But before we proceed with the questions and answers, of course, I'd like to invite our very supportive and illustrious Prime Minister to the podium to bring some brief remarks. Prime Minister.
Thank you very much, Madam Permanent Secretary. Let's give Dr. Stapleton Harris a special round of applause. I want also to recognize the Deputy Speaker of our National Assembly, Dr. Bernice Nisbet. Could you stand? Could we also, of course, recognize at the head table Dr. Cameron Wilkerson? Could you give him a special hand again? I want also to recognize Dr. Natalie Osborne. Doctor, could you stand? And I want to thank her. Last Sunday we were at church in Keon, and we were advised by Pastor Benbow that Dr. Natalie Osborne was going to be doing a special session for his membership on the vaccination rollout. So my commendations to you. I want also to recognize our very own Dr. Dale Crawford. I want also to recognize here Dr. Ufre. And of course, I want to recognize a very special friend who loves St. Kitts dearly and who has been working with us for some time, particularly in the issues of crime reduction, counseling and support, Dr. Sharon Gopal McNichol. Could we give her a special hand of welcome? We are happy to have her here, working with us to ensure that our country remains safe and secure. Of course, I want to bid a special welcome to all of you, my constituents, and all of you, my fellow citizens and residents of St. Kitts and Nevis. Welcome to this important town hall. Thank you very much for coming. I want just to give the strongest support to all the health workers who are working so excitedly to ensure that we defeat COVID-19. I ask that you give all the nurses at our health centers a special round of applause. We see them at work, taking the time, taking the patience to ensure that your health comes first. Last Saturday, I visited the Newtown Health Center, as I've been doing over the last 3 weeks, to see who is going, yes, to encourage persons to go, but perhaps more importantly, to say to the healthcare workers, the country values what you're doing. And I was heartened to have met 2 of our retired nurses who came back out from retirement to give special support to the vaccination program. Let's give Nurse Sylvia Isaac of Molyneux, now living in Frigate Bay, and Nurse Connor a special hand of applause for the work that they are doing. I'm advised that we have about 8 of them who have returned to assist us. We certainly need all of the support that we can to get this behind us as quickly as possible. And interestingly, the power lies in you. The power lies in you to turn things around. The power lies in you to ensure that we could get back to normal as quick as possible. And all you have to do is one thing: vaccinate. And we've been telling you this for over a year. We said you had to wear your mask. We said you had to do the physical and social distancing. We said you had to wash your hands very often and sanitize them. Because in the absence of a cure, in the absence of a vaccine, all these things must be done. The vaccines finally, at long last, have come to St. Kitts and Nevis. We have made them available to you free of cost. And all you have to do is to receive it freely. Do it first to signal that you care about you. You care about your health. The virus is there all around us. We are in the midst of it. And we have an opportunity to protect ourselves. And you wonder, Why are some people waiting? Why are some people waiting? Waiting until it is too late. But that is what will happen. Right now around the world, tomorrow we are having prime ministers and heads of government meeting. And we have invited Dr. Tedros, who is in charge of the World Health Organization, about which Dr. Wilkinson has been speaking. That is the body that by and large has the expertise and make recommendations about global acceptance of these vaccines. We have invited him to come to speak to us about vaccine. Because what is happening, the vaccines are now scarce. So those of you who are waiting, I can't promise you any will be there when you're ready to stop waiting. We have them now. They are to be used now. They have a shelf life. And they have to be used before the shelf life ends. That is the reality. Right now, countries are storing up what they can. And it is the larger countries, the countries with more money, who can afford to buy volume. We are a small country. When somebody comes to buy 10 million doses, and you go to a producer to say 47, 100,000, who you think he has time for? He has time for the larger purchaser who will make a difference. And you ask yourself, why are these countries doing that? And they have said that never again would their country be challenged in the way COVID-19 has challenged them. Never again. When we see what COVID-19 has done to the most powerful country in the world, United States of America, look weak and disorganized in the face of an invisible virus. You say you can't believe. In New York, they can't yet put all the children back in schools. Over 100 million students can't get to school. But in St. Kitts and Nevis, thanks to you and your government, since last year, we put them back into the schools. Thanks to you. In America, the churches and the church leaders are fighting to get back into church. Here in St. Kitts, to God give the glory, all our churches are still open. All we ask, comply with the COVID-19 protocols. The answer to this problem lies simply with you. And I don't know why people choose to listen to certain things and believe what they want to believe. And the thing that they should believe, somehow they are slow to believe. You're waiting. What are you waiting for? How do you explain that 7,000 persons have gone forward and you ain't gone forward yet? And you have not consulted with your doctor to say that is your doctor who tell you not to go, but you ain't gone for something that could make it good. And some of these very people who are not gone, they're looking for jobs. The new reality in the workplace, like it or not, nobody is going to be hiring people who are not vaccinated. Nobody will do it easily now. Very soon you are going to hear the airlines say they will not be able to take you unless you are vaccinated. Why are you going to wait till these things become a reality to be running up and down looking for vaccine when there will be none? That is what tomorrow's discussion is about. Equitable distribution of the vaccine. We recognize that the vaccines are going to some places up to this time have not had one dose of a vaccine. We were expected 21,600 doses this month. We get the report. They will send 7,000 plus this month. 7,000 next month, 7,000 the month after that. All people will say them I give you in a hacks and heroin, not so baby J. Peace, peace. There is a shortage, but we have enough now to ensure that more than half the target group can get at least their first shot. Do not continue to waste time and waste people's time by refusing to take the vaccine, which is now readily available to you. I want to encourage you to take life seriously. Take it seriously. And Dr. Wilkerson made an important point. The Queen, who is 90 plus years, took the vaccine. And when somebody said, well, you done 90, well, you don't just leave it to God more than less. She said, taking the vaccine is not just about you. It's for those that you love. It is for your grandchild. It is for your son. It is for anyone who is in your circle to have the protection that you will not be transmitting it to them. So I ask that you consider not just yourself. Consider your wife. Consider your boyfriend. Consider your girlfriend. Consider your children. Those 18 not going to be getting the vaccine. You can help to protect them by taking the vaccines. So I just want to encourage you. Taking the vaccination, just like the marks, is a sign of respect, and it is a sign of love for others. When you go in the shop, you put on your mask as a sign of respect for others who are there and for the shopkeeper. The new standard now is for you to take the vaccine. So, we used to say no mask, no business. We can soon begin to say no vaccination, no entry on the bus. No vaccination, no plane you could go on. No vaccination, people don't want you in their supermarket. No vaccination, people don't want you in the bank. All of those things. Because the world is now moving away from the mass requirement to the standard that you must get your vaccine. And hundreds of millions of people all over the world are trying to get it. Here's some of us sauntering and we're waiting to see. What you want to see. What you want to see. So again, I encourage you to act responsibly. Do not hesitate. I want you to get vaccinated. The sooner you do that, the sooner we can open up our country. The sooner you do that, the sooner those workers at Marriott Hotel, at Toy, at Jakarta, at Park Hyatt, at Four Seasons, who home waiting because there is limited business, the sooner they will be able to get back to work. And we will be able, as the country that has done the most successful job in containing it. When I hear the numbers in other countries, I say, we can't believe. Thousands in St. Lucia. Thousands are people infected in St. Vincent. Deaths in Antigua. Death in Grenada. The only two countries in the OECS no deaths. St. Kitts and Nevis. To God we give the glory. Give him a round of applause. There is a journey which we have to travel. And I was impressed the other day talking to the person, the principal, who is involved with the production of movies now taking place. In our country, 2 movies are happening. One at Park Hyatt called Below Deck. It brought in 140 guests to the Park Hyatt, a significant number at the time when nobody traveling. And the other over at Nevis. brought in 40 persons there to produce movies. I think that one, the outfit is called the MSR outfit. And when I spoke with the principal, he said, I said, well, how did you choose St. Kitts and Nevis? He said, I was directed to Barbados, and I visited there. I was directed to the Dominican Republic, and I visited there. He said that what made the difference, why you have to go outside with the phone call. He said what made the difference in the end was when he looked at the statistics with respect to the management of COVID-19. St. Kitts and Nevis was the safest place to be. And our excellent performance in doing the right thing, in keeping you safe, in preventing you from getting in the ICU, our success at doing these things will draw others here. The gentleman came to do one movie. He's going to be doing 6 movies in our federation, because we are the safest place to be. And so there are several other opportunities that will come our way. But we have to play the card, play the hand that has been given us in a very successful way. So let's get moving with the vaccination program. I hope tonight that those of you who have not yet been vaccinated will not waste another day. Do it tonight. Tomorrow has not been promised to us. So thank you very much for coming out in such fine numbers. I want to thank all the organizers who have come out and who have helped really to set up this facility in a way that it can be fit for purpose tonight. And it's so lovely to see so many of you. I want to recognize Nurse Woodley and thank you for your service and thank you for coming out. And ensure each of your workers at the Early Childhood Center that they go and get themselves vaccinated. And Baby J, when they come to your shop in Tabernacle, you say you done gone to get yourself vaccinated. Go up the road, go up the road, go up at the health center. We built such a nice health center in Tabernacle. People call it a hospital. I'm so glad we built a hospital in Tabernacle. So let them go there and get it done. So thanks again. May God continue to bless us. And may God continue to favor St. Kitts and Nevis. Thank you, madam.
Thank you, Prime Minister. Sound words. Isn't that so? Isn't that so? Yes, yes. So I want to thank our Prime Minister for his Herculean efforts in the fight against the pandemic. He has been outstanding, very outstanding, and his performance was stellar. And take it from me, who is at the top of the health system. I believe that no doubt that the caliber of the leadership that he displayed would go down and be recorded in the annals of our rich history. Thank you very much, sir. And we look forward to your continued support. You have promised that, and we can be assured of that. And now back to the presentation by Dr. Wilkinson. His presentation was sound, it was concise, it was very understanding and to the point. Do you now have any doubt? Do you have any doubt? No, I'm pleased to hear that because our nurses are waiting to administer the jab. 4 of them are out there. So they are ready for you. But do you have any questions? It's normal to have questions. Do you have any questions for Dr. Wilkinson? Anything that you need cleared up before the injection? Okay, yes?
Thank you.
Those outside, please know that you're part of this engagement. You're part of the group. You're also invited to ask questions. Please come inside when you have your questions to ask. And please listen keenly to the questions that are being asked. Thank you. Proceed.
Good evening to all. Dr. Wilkinson, your presentation was very good. And I came here tonight to hear you and to speak to you. After speaking to you, I'll have to make my mind up what to do. However, while you were speaking, you talk about allergies. Now, if someone has allergy to penicillin, ampicillin, and septrin, would you encourage them to take the vaccine? That's my question.
Yes, I would. In that, what you have to understand is just because you're allergic to one drug doesn't mean that you'll be allergic to others. And so there are some persons who are allergic to penicillin, but they're not allergic to sulfur. And the vaccine doesn't have any of those that you mentioned. And so even if you have a history of allergies to certain things, you can still take the vaccine.
Okay, thank you.
Yes, a pleasant evening to everyone. I'm allergic to penicillin injection. I does not take injection for a number of years. I'm 65 and I want some clear and this vaccine. I don't want to take it and it shut me down.
Okay. Well, number one, persons who are 65, persons who have other medical conditions like diabetes, hypertension, asthma, these are the persons who should be stepping forward and taking the vaccine. Because if you got sick from COVID-19, you may not survive. And so this vaccine is actually intended for you. I was at a session just yesterday, and there was a gentleman from India who is living here. And he said, thank God he is in the Federation of St. Kitts and Nevis, because if he was in India, they never would have gotten to him for him to get the vaccine. And because in most countries, they're dealing with frontline workers. But here in St. Kitts, we are fortunate that we have extended this vaccination program to everyone, including the vulnerable. And so you should take it.
Thank you.
And if you don't have any questions, you just need to start filling out that form. Is that? Yes. Because one doesn't have to feel compelled to ask a question here. And if you're afraid of the mic, as I said before, we have a number of doctors who would be circulating, who can answer your questions. I just want them to stand up. So Dr. Crawford, Dr. Osborne, Dr. Nisbet, just stand up so that they can see you all, so that if anyone has a question once we finish this formal session, they can go to you individually and ask a question, or you can approach me also.
Yes, come please. Is there anyone else that would like to who would like to ask question? No question means that you are ready you're well informed, you are empowered to take the vaccination. So don't hesitate, don't wait. We are ready tonight. Just the nurses are just around the corner. As you enter, you turn straight ahead of you. You will be guided. I also want to say, just in case you want to hesitate any further tonight and you still need to think about it, that the vaccinations are available at all the health centers in St. Kitts and Nevis from 1 p.m. daily. Vaccinations are also available at the Newtown Health Center and at the Basta Health Center on Saturdays, and we expect to be adding 2 more health centers from the rural areas so that those of you who live in the country do not have to go to the town to take your vaccination. And so, but we're here, we're ready tonight. Okay. All right. So I want to thank you for coming, and before we close off officially, I want to invite Miss Desiree Huggins to render a vote of thanks to you.
Good evening. Please permit me to adopt the protocol that has already been established. I have been charged this evening to deliver the vote of thanks for this evening's proceedings. Thanks must be first given to the Ministry of Health under the stewardship of the Honorable Akila Byron Nisbet for organizing this COVID-19 vaccination clinic and information sharing session. To our most abled moderator, Dr. Dolores Stapleton Harris, Permanent Secretary in the Ministry of Health, we extend a heartfelt thank you for managing the flow of the proceedings with skill and grace. To Pastor Iselin Lewis, a product of our community, we wish to thank you for invoking God's blessings on this activity, as we all know that without his guidance, we will surely be lost. From the beginning of the COVID-19 pandemic, Dr. Cameron Wilkinson, our medical chief of staff at the Joseph and France General Hospital, has been a staple on the various platforms that have been established to update and sensitize the general public on the latest developments pertaining to the pandemic. We are therefore most grateful to have him here with us this evening, imparting his knowledge and in educating us on the importance of getting vaccinated and addressing the concerns we would have raised. Thank you, Dr. Wilkinson. I, for one, am even more convinced of the importance of being vaccinated, not just on a personal level, but for the country in its entirety. The protocols established owing to the onset of COVID-19 have become our new normal. Thanks must be therefore expressed to our leader, Prime Minister, Honorable Dr. Timothy Harris, for his superb leadership in ensuring the citizens and residents of St. Kitts and Nevis remain protected by implementing and enforcing the necessary measures This has made St. Kitts and Nevis the envy of the Caribbean, or some might say the entire world. The youths are indeed our future. This is a proven statement, and it is on this premise that I must thank the beautiful young women who would have volunteered to manage our COVID-19 screening desk this evening. This, we have seen, has become an integral part of our new normal. The success of this evening's session can be further attributed to the support from our corporate partner, the TDC Group of Companies. Thanks must be extended for their invaluable contribution, as the level of support they have continuously provided cannot be overlooked. Particular recognition must be also extended to members of the community, specifically Ms. Rolise Brooks, Mr. Douglas Wilson, and Mrs. Rose Johnson, who would have worked tirelessly to ensure all the necessary pieces were in place to execute this activity successfully. I would also like to thank representatives of the media who are here to assist with the broadcast of the event on our local radio and television station and via the World Wide Web. To you, the general public, constituents of St. Christopher 7 and the surrounding communities, I extend a very special thank you for your participation in this evening's session. Your presence this evening signifies that you too recognize the importance of adopting the new normal, understanding that the sooner we abide by the guidelines put forward by our leaders, the sooner we vaccinate, the sooner we are likely to return to business as usual. With that said, I wish to take this opportunity to further encourage us all to roll up, to roll out. Thank you.
Thank you very much, Desiree, for that wonderful vote of thanks. Thank you for the work that you have been doing in the community, and thank you for assisting in the organizing of the session tonight. So, ladies and gentlemen, everyone, there you have it. You would have had it. Our next activity is for you to go and have your vaccination if you haven't had it yet. And as you wait around, there are refreshments that you can partake of. So I want to end by encouraging you, all of us, to be vaccinated. Don't wait. None of us is safe until all of us are safe. Let us protect ourselves, our families, our loved ones, our communities, and our country. Don't wait. Don't hesitate. Let's vaccinate, and let's do it tonight. Thank you.
Hey, what's up?
Good, good. Bless up, bless up.
Nice. How was the recording?
It was good, man. It was good. You know, always a pleasure trying to send a message to my people. All right,
Love
so
it.
we would like to welcome our Minister of Health, the Honorable Akila Byron Nisbet, who's blessed us with her presence to speak a little bit on the COVID-19 related matters as we move forward to achieving 70% herd immunity. So we have a few questions for her, and we'll get into them right away. So, Ms. Nisbet, how's the Roll Up to Roll Out campaign going so far?
It's going really good. We have just over 5,000 persons who've already been vaccinated, and more persons lining up to vaccinate. And at this point, we're at that stage where we're actually going out into the communities and vaccinating persons where they are, which is also very helpful.
Right.
So it's going really good. And your song has been making an impact too.
Nice. I don't wanna lose you. No, man. All right, so next question. What's the process to get vaccinated, and where do you go? What's the key of it?
It's actually really easy. All you have to do is show up at any of our 11 health centers.
11.
There's a short checklist that you have to fill out just for us to make sure everything is okay with you and get some background on your health. And then a nurse, nice friendly nurse, will take you to one of our rooms, give you that injection. After you finish being vaccinated, sit for 15 minutes. Once you're all clear, good to go. Pretty
easy. 1,
2, 3, done.
All right. So what would you say to those still skeptical about taking the vaccine?
I'm going to tell them it's simple. We've already have over 5,000 persons who've taken the vaccine, and everybody's still good. Just a little pain in the arm around the injection site. Some persons had fever and chill, but that's all part of vaccination. The way you think about it, that means the vaccine is working.
Right.
And so I would say to those persons, don't hesitate. Don't wait. So many persons already got the vaccine. So why not you?
Right.
You're helping yourself, you're helping your family, you're helping your community. So roll up to roll out.
Don't wait, just vaccinate.
Don't
Come
wait.
on, man. We know at the vaccine stage, what can we expect for the next 6 to 9 months?
What we can expect is that once people get vaccinated and we reach that 70% herd immunity, then we can start talking about relaxing some of the quarantine restrictions and some of the other restrictions. It's about thinking about when you're traveling. So then you don't want to have to travel and come back and quarantine for 2 weeks. Because then you have to add all that into your vacation time. If we can get to herd immunity, which means we could get enough people vaccinated so that if the virus gets in, it does not spread as much as it's been spreading without the vaccine, then we could relax the quarantine and then you wouldn't have to spend that 14 days in quarantine anymore. We can relax that. You can travel a little bit more freely. If you look at it, some of the countries are even implementing vaccine passports, which means that you have to be vaccinated to travel to some of these countries. So we're going to see some changes, good and bad, because COVID is real and it's taken a lot of lives throughout the world. And so the only way that we'll be able to make sure everybody is safe is if we get vaccinated. So once we're able to reach that herd immunity, that's when we'll begin to see that we're able to relax some of the restrictions, more of the restrictions, that is. We can travel a little bit more freely. We can relax some of the quarantine time. So that's what we can expect. But we have to get to that 70% mark to see that.
Right. Let me just put this out there. We would be able to party too.
Yes!
Like we really want to.
With no
Masses,
restrictions, no 150 outdoor,
man.
no 100 indoor restrictions, but to be able to freely party.
Yes. All right, so Ms. Nisbet, what are you looking forward to once we get back to normal?
Well, normal or some form of normalcy, vacation. I'm ready to roll up, to roll out, to really have a good vacation. To visit somewhere else in this world and just be in a different space, because we've been locked up on the island for so long.
And I think you deserve it.
That is what I'm looking forward to. What about you? What are you looking forward to?
Let's see. Looking forward to traveling, like anyone else would. But sugar mass. I feel like walking up a little bit. I'm not just doing that. I need to enjoy myself, you know what I mean? Because we've been inside for so long. I just want to enjoy the whole freedom. Don't have to worry about no time, the mass, the crowd, anything. I just want to be free again.
Nice.
Yeah.
That's good. That's why we need to
roll up to roll up. So you know the lyrics to the song, right?
Yes, I do.
All right, let's
try. Test me.
Yeah. I know we can make it. It's only just a phase. Once we're vaccinated, everybody gonna be safe. Hey, one kind, one people. We are roll up to roll out. 'Cause no man's alone. Do what's right. 'Cause I love you. And we're in this together, my sister, my brother. I don't wanna lose you. I love you too much. I think it's better for us, yeah. It's better for us. I don't wanna lose you. I love you too much. I think it's better for us. Roll up to roll out.
Well, Ms. Nisbet, we'd like to thank you for blessing us with your presence and sharing the information with us. But guys, we want to remind you to adhere to the COVID-19 protocols, wear your mask, wash your hands, social distance. You know what I mean? Until we get back to normal. But also, don't wait, vaccinate. We have to roll up to roll out.
Once we're vaccinated, and everybody gonna be safe. What kind?